My name is Keshvi Fichari. I am from 4th year B Physiotherapy and my topic is emphysema. Now, first of all, the definition of the emphysema. Now, what is the definition of emphysema? In anatomical terms, it is an abnormal permanent enlargement of the air space beyond the terminal bronchioles with disruption of the walls of air space without fibrosis. It is chronic obstructive pulmonary disease. Now the types of emphysema. There are three types of emphysema. First is central lobular. There is destruction and the dilatation of the respiratory bronchioles commonly associated with smoking. Now the second one is pan-acinar emphysema. All the parts of the acinus are affected. It is commonly associated with alpha-1 antitrypsin and smoking. Third one is paraseptal emphysema. There will be distal acinar alveolar ducts predominantly affected. Now there are the signs and symptoms. There would be dyspnea, productive cough. There would be increased work of breathing, wheezes. The barrel-shaped chest is seen in the patient. There would be decrease in the expiratory flow. Cor pulmonale, there would be decreased cardiac output. There would be pedal edema, clubbing are seen in the nail bed. There would be a cyanosis, that is blues discoloration. Then V by Q mismatch and respiratory failure. These are the signs and symptoms. Now the investigation. Investigation is done by the X-ray. Hyperinflation is seen, horizontal alignment is seen, and the flattening of the diaphragm is seen. And there is the investigation is also done by the PFT and ABG analysis. In PFT there would be a reduced FEV1 and reduced FEV1 by FVC ratio. And in ABG analysis there would be reduced PO2 and there would be increased in PaCO2 value. Then for the management there are two short-term goals and long-term goals. For the short-term goals, we would first reduce the dyspnea, then we would improve the breathing, then improve the chest expansion, then reduce the tightness and the reduce breathlessness during ADLs. Now for the long-term goals, we would first go for the improved respiratory muscle strength and improve exercise tolerance or exercise capacity. Now, first one, how we would reduce the dyspnea. There are 5 dyspnea relieving positions. First is high side line. The patient should be seen side line, sleeping in the sideline position. Second is forward lean position. There would be a pillows on the table and the patient should lie forward bend. Then relaxed sitting position. Patients should sit relaxed in a chair. Then the fourth one is relaxed standing, and the fifth one is forward lean standing. The patient should lean forward like supported on some like a railing or a chair and lean forward. Second one is to improve breathing. There are various breathing exercises are given: diaphragmatic breathing, pursed lip breathing, segmental breathing, and yes, respiratory devices like spirometer is also given. Now to improve the chest expansion, there is a chest expansion exercises. Thoracic expansion exercises are given. Here the position of the patient is sitting. Inhale, arms up in flexion. Like we have to ask the patient to inhale, and when the patient is inhaling, we have to ask the patient to take the arms up. And then we have to ask the patient to exhale and forward lean, forward bend. The second is sitting. There is arm sideways. That we have to ask the patient to do abduction while inhaling and do back to the normal position while exhaling. Then the third is the patient position is sitting. The hands at the back of the neck like this, and the forward bend with both the elbows come nearer. That is while exhaling. The fourth is the patient position is sitting. In inhale, hands at the lower lips. Hands at the lower lips while inhaling, and while exhaling there is lateral bending on the same side. Now to reduce the tightness, the stretching of the tight muscles are given. Then to reduce the breathlessness during activities, there will be activity pacing. Then set the targets. We have to set the different targets and then take rest. Now to improve the exercise tolerance, gradual incremental aerobic exercises are given. Like for example, we can ask for the walking, we can ask for the jogging, then treadmill, then step up, step down, etc. exercises with incremental. Thank you.